Medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
Both confusion and controversy surround the food testing of whether it's IgG or it's IgE. Let me see if we can make it clear. Immunoglobulins play a critical role in our body's acquired immune system, especially IgE. When assessing food-related immune reactions, testing could provide insight into different components of the immune mechanisms. However, it's very important to differentiate these immune markers and then their clinical relevance and, of course, the appropriate context for their use. Now, let's talk first about IgG testing of food. It's a delayed hypersensitivity. It is a chronic inflammation, and IgG is the most abundant immunoglobulin, if you remember, in the circulation and plays a critical role in long-term immune responses. The context of food testing, IgG, is used to detect delayed immune reactions, chronic inflammation, and other various health issues. Now, that's very different than IgE-mediated food allergy. They cause immediate hypersensitivity reactions, and they take longer, or shorter than the IgE-mediated, which can take hours or days before they manifest. Be aware, there are subsets of IgG, IgG 1, 2, 3, 4, and within each of those subsets, that recognizes different issues. But let's just talk about IgG in general and what some of these food allergy symptoms could look like. Gastrointestinal problems like IBS, bloating, diarrhea and constipation, migraines and headaches, autoimmune conditions, skin conditions like eczema, psoriasis, acne, and even joint pain and musculoskeletal inflammation. Remember, IgE testing is an acute, immediate response. Now, a new antigen and a very short occurrence problem is IgE, that it activates the immune response. It can be valuable in identifying acute type of reactions to foods. So basically, if you're looking for a food that causes anaphylaxis or, let's say, angioneurotic edema, then look by doing IgE testing. It's also useful for assessing infections and inflammatory conditions where recent immune activation is suspected. All right, let's try to summarize this. IgE is typically indicated for acute food antigens and responses, identifying recent exposure to a food immune response in compromised patients as well. Key takeaways. IgG antibodies are part of the body's normal immune response to food. The presence of IgG antibodies indicates exposure to food, not always necessarily to an adverse reaction. Now, some argue that IgG responses could indicate a tolerance rather than intolerance, but there's no way of knowing until you look at these plus the history of the patient and do other historical and physical examination. Immune tolerance is the process by which the immune system recognizes and accepts substances that may be not harmful, such as food proteins, without mounting an aggressive response. IgG antibodies may play a role in promoting immune tolerance because it binds to antigens in the food, prevents them from triggering inflammatory immune responses. This can help the body distinguish between harmful pathogens and harmless dietary components. And here's my opinion. IgG testing is most useful for chronic conditions and long-term food sensitivities that may contribute to systemic inflammation and even immune dysfunction. IgE testing is best suited for identifying recent immune and hypersensitive immediate reactions, and it's not commonly used for food sensitivities unless they're aggressive, like eating a peanut, for example, and having an anaphylactic reaction. IgE testing still remains the gold standard for diagnosing true food allergies, especially anaphylaxis or immediate hypersensitivity reactions. I hope this helped you differentiate between the two.